tyranny has kind of rolled out. Just so that you know, I'm sure you noticed I have limited public speaking experience, but I did want to share with you some of the concerns that I have developed working as a nurse during the era of COVID. For background, I have been a nurse for 7 years. I'm not retired yet, by the way. Still working. And I started in healthcare as a CNA starting in August 2006. My husband also has been a CNA for 10 years. In the beginning, most of the nurses and healthcare providers that we know were very concerned, and we were all careful about limiting the risk that we might present to our patients in the long-term care setting, which is the healthcare setting that I'm working in right now. And we knew that if our residents became infected, it would be because we brought something into them, especially as we received guidance to limit visitors to the nursing home environment. Our family limited going out only to essentials like shopping. We were careful to wear masks and did everything that was recommended. If we travel, all employees are required to quarantine at home for 2 weeks before we're allowed to return to work. Long-term care employees reported symptoms, took temperatures every single day, arriving to work with a mask on our face, face shield, goggles, things like that. Eventually, PCR tests became available, and the government guided administration of these tests sometimes twice weekly, and an additional time within 72 hours if we had a PCR positive test in the facility, everybody got to retest within 72 hours. Eventually, they rolled out digital facial scanning, which replaced manual temperature screenings and clipboards for answering questions about symptoms. The PCR test swabs do contain sterile ethylene oxide, a known carcinogen, and are swabbed right into our nostrils, high up where it's lots of blood vessels. When I went to my well woman exam at the peak frequency of our PCR testing, my provider expressed concern at how irritated my sinuses were. And they were pretty angry when we were testing, and more testing. I've had friends who have developed bacterial and fungal infections on their face from chronic masking. No one knows what the long-term effects of inhaling microfibers and chemical contact from the swabs and masks are going to do long-term for all of our first responders, medical providers. We prepared our facility to understand how to beat COVID by listening to representatives from Lebanon VA long-term care. They had an outbreak probably early last year before all of the politicians got involved, and they were successfully able to treat early outbreaks in their facility using hydroxychloroquine, azithromycin, and steroids. I think they even had a vet that was 103 years old who pulled through when they got the infections in their facility. They did a fabulous job. When all of this started, I did not object to any of these precautions because we strongly as a family believed that we were doing all of these things to protect the elderly people that we are so blessed to be able to provide care for. In hindsight, I know some of the elderly allowed themselves to die because they refused to live without family visitors coming in. We had one resident who I am telling you, when they announced that you had to be on hospice care to be able to get your family in there, and she depended on her daughter seeing every single day, she went on hospice care. And then finally the rule was changed by the Center for Medicare and Medicaid Services that unless you were actively dying, you could not have your family there. And that moment, I'm telling you, started actively dying and got it done. And that was not the only person who was deprived of family contact who decided, okay, enough is enough. I'm going to start dying so that I can see my family.
Wow. Wow.
This last summer, a summer a year ago, my husband and I had to go out of state to see my grandfather and then later my husband's mom as they were passing away. My mother-in-law passed away in memory care in California where visitors could not even make direct contact. They had so many rules in place. Everybody who came to visit had to have gloves on. We couldn't touch her skin. We had to touch her outside of her like a blanket on her. You couldn't cuddle her. You couldn't kiss her. You couldn't do anything. Luckily, as a nurse, I was able to get closer because I helped the lady there who was doing her pressure injury care. I got to help reposition her so I could break all kinds of rules. And because my husband's a CNA, he got to break all kinds of rules, and we helped reposition her and make her comfortable when she was passing together. My grandfather, in contrast, had the privilege of passing away at home, surrounded by all of his family who loves him. And that's what we need for all of our elderly. When people are passing out of this life, they have the right to